Hi, this is Dr. Adam Stewart. I'm here with another video trying to show some of the invisible work and administrative burden that family doctors face these days. And this one is related to a bit of a topical story that came out just recently. The CBC News released, for example, an article on certain pharmacies potentially inappropriately doing what are called MedsChecks, which I'll show you in a second. This came out on February the 28th, just passed. But I just want to take a step back quickly, and I did another video on my blog about the cost of even the most simple FYI interruption to family doctors. And I showed a demonstration there about how even just a quick FYI that doesn't need any action costs at least $6, and that anything that requires any sort of reply or action costs way more than that in terms of doctor time, staff, and resources and things like that. So back to this article. It just shows that you can read it or Google it if you want, but one of the key points is that I just wanted to point out is that some of these MedsChecks that pharmacies were doing, they're paid up to $75 per call, whereas a family doctor visit, in comparison, a full family doctor visit costs $37.95. That is what a family doctor is paid for a full visit, which actually, ironically, includes doing a MedsCheck at pretty much every visit that we do in our visit, which I'll show you in a second. So here are some examples of some of these MedsChecks. And again, remember, every piece of paper that comes into a family doctor's office causes interruption, time, and decision fatigue. So here's one, we have to open up a chart, orient to that chart, see whose name it is, see what the background is, see if there's anything to do. But here's an example of one that there's countless examples that any family doctor can show you that comes in every week. But, no action required. Okay, so great. But I still had to check on this and review it to make sure there was no action required. But just a simple example, here's a person who's stable in their 30s on 3 different meds. I'm not sure that person had that complex of medications that needed reviewed. Here's a person who has on a, again, remember, this is we have to look through this, get oriented to the chart, get oriented to the piece of paper, scan through 2 or 3 pages in this example. Here we got a patient who's on vitamins, a couple vitamins, a cream, antibiotic cream, and 1 prescription oral medication. So probably, no action required. Probably, arguably, maybe that didn't need to be billed $75 to OHIP. Here's one that comes in again. You have to open up the chart, figure out what patient it is. Oh, here it does say there is some action required. Okay, well, what's that about? Well, I kind of have to scroll down and see. Okay, well, there's 1 med, there's 2 meds, there's the other meds, there's the Ozempic that they were talking about. But there's no. I still to this day cannot figure out what action I'm supposed to do or recommended on this one. But here's where it gets really interesting though so here's a guy, an elderly guy who's on 1 medication, metformin, for years, stable. I'm not sure why this guy required a MedsCheck on his single medication. So I actually, around the time this article came out, I was getting a little bit frustrated with all the interruptions we were facing. I actually sent this pharmacy back, every fax, every interruption, every piece of work costs us time, mental energy, and resources. Thank you for this MedsCheck on this stable patient who is only on metformin. Never received a reply on that one. Here's an interesting one. Here's a youngest person on a few meds. And actually, this is just 1 page. This is all we got. No medications in this case, just FYI. We reviewed this patient's medications. I think they were on maybe 3 or 4. No problems. Okay, great. Now this was done December the 15th, 2023. Now, you won't believe this, but 2 months later, this exact same patient, February the 20th. Again, no details, just no meds, no problems required. So this was the same patient billed a MedsCheck assessment to the government within 2 months of each other, requiring no issue. So I actually sent this pharmacy a letter, again, being frustrated with all this. After your 2 MedsChecks, December 15th, you had no concerns. You felt it necessary to do another MedsCheck just 2 months later, ? I attached both for proof. Never heard back on that one. Here's a patient. Here's an interesting one, too. Just to see, now, this patient is admittedly a little more complicated, but look, another example of there's a MedsCheck here done February the 15th. There was one done the month prior. Looking back, March of last year and January of last year. There's 2 back-to-back each year. Even looking back September, there's 2 done per year on this 1 patient. So again, I just want to show you again in comparison here's what a family doctor does in their visit for that $38 or $40. So this is a fake chart, but with every diabetic visit, for example, that a family doctor does, we are not only checking vital signs, checking a person's glucose, blood pressure, whether they're on a statin, cholesterol or not, body weight, kidney function, blood thinners, eye exams, foot exams, smoking status, immunization statuses, setting goals. We do all that in one visit, and guess what we also have to do throughout we review all their medications inherently in that visit. And for that, a visit like that, we are paid $40.55, which includes the medication review and includes all the diabetic care that the patient receives, in comparison to apparently what pharmacies are getting paid up to $75 for this simple piece of paper that says no action required.